Hello and welcome everyone, and thank you for joining us. Before we begin, just know that we are recording this webinar for later viewing and that we cannot provide any technical support in the Zoom. Hello and welcome. My name is Michelle, and joining me with this demonstration today is C.H.A.R.L.I.E, and our moderator is Anna and Stacy.
Hello.
Please feel free to type your questions in the chat box throughout the webinar. This is an overview of C.H.A.R.L.I.E, our full body infant simulator designed for use with the Neonatal Resuscitation Program and Pediatric Advanced Life Support Education. C.H.A.R.L.I.E is soft, realistic, and has won EMS World's Top Innovation Award, as well as Best Manufactured Product in Wisconsin. This simulator is a full-term newborn for training on the most common neonatal care scenarios. It enables nurses and emergency personnel to practice the essentials of neonatal care. C.H.A.R.L.I.E is a full-body infant manual simulator that is 19.5 inches or 49.5 centimeters from crown to heel and weighs approximately 8.5 pounds or 3.86 kilograms. C.H.A.R.L.I.E is also heat resistant and can be used in a neonatal ICU incubator. C.H.A.R.L.I.E is offered with two options available. The first option does not include the ECG simulator, and the second option includes a set of 4 defibrillation adapters and an ECG simulator. C.H.A.R.L.I.E features include interchangeable intubatable airways for breathing with normal and advanced ventilator options, ECG and defibrillation capabilities, 7 manual palpable pulse points, IV hand and foot, left nostril NG tube placement, chest tube placement and care site, central line care via a PICC site, a patent umbilicus with venous and arterial access, interosseous infusion with palpable patella and tibial tuberosity, interchangeable genitalia for catheter placement, and the optional ECG simulator. C.H.A.R.L.I.E comes out of the box with, and as appears on the table, a full-term infant simulator, 2 replaceable airways, a normal and an advanced, baby powder, blood powder, a carry bag, a defibrillation chest, leg and arm skin and veins, intraosseous bones, fluid supply bags, genitalia, birth defects, needles and syringes, lubricant, and the optional ECG simulator. Let us start with showing you how to install the airway and insert the defibrillation chest skin. With the included lubricant, thoroughly lubricate all the outside surfaces of the airway. Insert your lubricated finger into the airway. Push the tube end of the airway into the mouth and slide the airway down into the head. Gently pull up the defibrillation chest insert and slide the tube from the airway into the hole at the top of the chest insert. Fit the chest insert back into the chest cavity. We will now demonstrate how to intubate. C.H.A.R.L.I.E allows for normal intubation and advanced or difficult intubation skills to be practiced. A number 1 Miller blade and a standard 3.5 millimeter ET tube or number 1 LMA is needed to practice airway management skills. Always be sure to generously lubricate the recommended equipment with the lubricant provided. Gently slide the blade into the mouth and depressing the tongue to view the airway. Insert the ET tube or laryngeal mask airway following general practice guidelines to place the tube. Ventilate the infant airway simulator using a bag valve mask following general practice guidelines. Now we are going to show you how to connect the interactive ECG simulator. For manual defibrillation, use the round defibrillation adapter posts into defibrillation anterior and posterior sites. Attach the defibrillation cables to the interactive ECG simulator. Connect the 4 colored limb leads to the same colored snaps on the side of the ECG simulator. Connect the limb leads from your defibrillator or monitor to the appropriate anterior sites on the infant simulator. Once you have set up and connected C.H.A.R.L.I.E to the interactive ECG simulator, turn on the interactive ECG simulator by pressing the on and off button. When turning on the ECG simulator, the default selections are the adult age group and normal sinus rhythm. Press the age group button to select pediatric rhythms. Press any of the rhythm buttons to select the rhythm for the scenario you are running. The rhythm will be displayed on your AED monitor. To convert, select the initial rhythm to display and then press the Convert button. Now select the rhythm to display after conversion. This rhythm will be blinking. Shock the mannequin using industry standards for infant defibrillation. Using 20 joules of energy are enough to convert and do not go over the industrial standard. After shocking Charlie, the blinking rhythm will turn solid on the interactive ECG simulator and will be the rhythm displayed on your defibrillator or monitor. CPR may also be performed on Charlie. Please follow your local or national CPR standards for infants. Anna, are there any questions in the chat?
Hi, Michelle. I have a question here. And the question is, if I have my own ECG simulator, will it be compatible with C.H.A.R.L.I.E?
Great question. Yes, absolutely. If you already have an ECG simulator, such as shown in this presentation, you can use that on your C.H.A.R.L.I.E. The options to purchase this mannequin come with or without the ECG simulator included.
Thank you, ladies. We are now going to move on to the pulses. C.H.A.R.L.I.E features 7 functioning pulse sites: the right femoral, the left femoral, the right brachial, the left brachial, the right carotid, the left carotid, and the umbilical stump. The pulses are manual and can be simulated by attaching the squeeze bulb to the site and squeezing at the rate you select. To perform a pulse check on C.H.A.R.L.I.E, gently pump the inflation bulb to activate the pulses as desired in any of the 7 functioning pulse sites. The chest tube. A chest tube may be inserted into the site on the left mid-axial line. This is a non-functioning site that may be used for practice in chest tube care only. Gastrointestinal. The left nostril will accept an 8 French NG tube that will pass into a small tube embedded in the chest cavity of the infant simulator. It is important to note that this is for tube placement only, and no fluids should be infiltrated into the simulated stomach cavity. To place the tube through the nostril, generously lubricate the recommended 8 French NG tube with the lubricant provided. Feed the NG tube through the left nostril and follow your general practice guidelines to place the tube. Moving on to the IV hand and foot. Charlie's right hand and right foot are both equipped with functional IV access in infusion practice. Install the included tubing so that it lies securely in the channel. And make sure to lubricate while inserting the tubing. Attach the luer fitting to the open end of the tubing to connect the tubing from the hand to the foot. Pull the powdered skin over the hand, taking care not to dislodge the vein tubing. You can follow the same procedure for the foot. Connect the hand tubing to the foot tubing and connect the free ends of the hand and foot tubing to the fluid supply bags. Performing intravenous injections and blood withdrawals properly will give realistic flashbacks. As you see, flashback will occur when the included 25 gauge needle is in the proper position.
As we can clearly see, Colette is not a medically trained instructor. Having trouble finding the vein, Colette? There we go. Fantastic.
Pick line. The left arm of Charlie will accept a 2 French catheter via the molded access site. Lubricate the catheter thoroughly with the supplied lubricant before insertion. This site is intended for practice site insertion and care only. Do not attempt to infuse with fluids. Anna, are there any questions in the chat?
Hi, Michelle. Yes, we do have one question here. And the question is, we use hands-free defibrillation pads. Will this work with C.H.A.R.L.I.E?
Yes, so the answer is absolutely. You do not need to use paddles. You can use the training pads you can use pads or training cables as well.
Thank you, ladies. The patent umbilicus. The umbilical stump features one patent umbilical vein and one patent umbilical artery, and catheterization is able to be done in both. Up to 5 milliliters of fluid or simulated blood may be infused into or withdrawn from the umbilical reservoir through either vessel. To fill the reservoir within the abdomen, gently pull out the umbilicus and use caution not to disconnect the pulse system tubing. Using the supplied syringe to press no more than 5 milliliters of simulated blood into the abdomen and place the umbilical stump into the abdomen. Carefully replace the umbilicus. The umbilicus is now ready for catheterization or blood withdrawals. To take blood samples, lubricate the catheter. Follow the institutional guidelines to withdraw the blood. To infuse fluids, leave the reservoir empty and follow institutional guidelines. The maximum capacity is approximately 5 cc's of fluid. The intraosseous leg. The left leg of C.H.A.R.L.I.E incorporates an intraosseous infusion feature. Palpable landmarks include the patella and the tibial tuberosity. Any commercially available intraosseous device may be used to place the needle. The bone is pre-filled with simulated blood and will provide a flashback when the needle is properly inserted. To install the bone, correctly position the bone in the leg cavity and slide the powdered skin over the leg. Any commercially available intraosseous device may be used to place the needle. Here, we are using a manual intraosseous needle. A blood flashback will occur when the needle is properly inserted. The bones can be punctured multiple times. The leg skin and bones are easily replaceable for baby C.H.A.R.L.I.E. The genitals. The male and female genital inserts may be used interchangeably. The genital inserts are for catheter placement practice only and not designed to deliver fluids. The rectal opening may be used for the administration of rectal medications in suppository form. Please do not attempt to infuse fluids. To interchange and install the genitals, select either the male or the female genital. Apply a dusting of baby powder to the backside of the genital insert and slide the insert into place in the infant simulator. To insert urinary catheter, lubricate a 5 French straight urinary catheter and insert following institutional guidelines. To administer rectal medications and performing a simulated temperature check, always lubricate anything that will be inserted into the rectum with the supplied lubricant and follow institutional guidelines. Defects. 2 birth defects are included with C.H.A.R.L.I.E. An omphalomocele birth defect that fits over the patent umbilicus and the neural tube defect that fits into the hole on the back of the infant simulator. Heat. C.H.A.R.L.I.E is also heat compatible and can be placed in an incubator for added realism to any infant neonatal resuscitation program simulation. To recap, C.H.A.R.L.I.E is durable, has lifelike anatomical features needed for use with training for various neonatal simulations established in the Neonatal Resuscitation Program guidelines. Features include NG tube placement, intubation, CPR and defibrillation, PICC line placement, IV injections and withdrawals, IV infusions, chest tube placement, umbilicus catheterization and fluid infusion, urinary catheterization, administering rectal medications, and performing rectal temperature checks, intraosseous leg infusion, pulse features, and incubation heat compatibility. Anna, are there any additional questions in the chat?
Hi, Michelle. I see two questions here. The first question is, are there any inflatable lungs when Charlie is bagged? And what about chest rise and fall?
Yes, absolutely. When Charlie is bagged, you will see chest rise. There is a bilateral chest insert and the unilateral chest insert available that come with the simulator.
Thank you,
can see.
Stacy. And the next question we have here is, what type of glue can be used in case there's a rupture?
Anna, can you help me with that question?
I believe we'll have to do a little research on that one in terms of what kind of glue may be used. So we will get back to you on that question. And I see who messaged in the chat. So I will send a message once we have that answer.
Thank you, Anna.
Practice all the essentials of neonatal resuscitation with a simple simulator, as well as any birthing scenario using C.H.A.R.L.I.E. C.H.A.R.L.I.E is durable, versatile, is easy to handle, has high performance and robust construction with a 5-year warranty included. Anna, are there any further questions on C.H.A.R.L.I.E?
Hi, Michelle. There are no further questions at this time.
Thank you. If there are no further questions, it is time to take pediatric advanced life support to the next level. Are you ready? For additional information on C.H.A.R.L.I.E and all pediatric products we have available, such as our micro preemie simulator, nursing skills and advanced life support simulator, and infant crisis mannequin, please contact your regional sales director or manager. Information is also available on our website at www.nascohealthcare.com. Please follow us all on all of our social media, including Facebook, Instagram, Twitter, LinkedIn, and YouTube. Thank you for coming.